Hi, I'm Master Ruth, a registered Chinese medicine practitioner. Today I'm going to talk about Lianhua Qianwen Jiaonang, the Chinese herbal capsules given out in the government care packages. But what are they? What do they do? Are they safe to use? Are they really good for treating the COVID patients? Are they good for preventions? Are they safe for pregnant ladies or used during your breastfeeding stage? Today I'm going to share with you my experience and also my advice. 莲花清瘟胶囊, 莲花 are the two active ingredients in the formula. Qinwen is anti-epidemic and jiaolang means capsule. So lian is the short form of lianqiao. Hua is the short form of jinyin hua. They are two different kinds of herbs. So lianqiao, I always use it for cystic acne or ulcer, bacterial or viral infection. It is listed as the first active ingredient in the formula. And jinyin hua in English is Japanese honeysuckle. It's listed as the third active ingredient in this formula. So the two together makes it the perfect couple to help clear the inner heat as well as the toxin. And then we always use it to treat the wind hot type of flu with the symptoms like fever, cough, sore throat, dry lips, constipation. You can see some yellowish discharge, as the phlegm or the nostril mucus, and sometimes you will have some muscle pain as well. They have also added in a lot of other ingredients here besides the two that I just mentioned. Other ingredients that can help soothe the throat especially. So the cooling properties of banangan and also guanzong. Those two ingredients are particularly good for cough and sore throat. And then they also added in some ingredients to expel the dampness and also replenishing the qi. The qi is particularly important in recovering, especially for people who suffer from COVID, coughing all the time, that you will have short of breath. So the qi deficiency, now you need to have some replenishment so that you can recover more with this vital energy with you. According to my experience and also the clinical studies in China, Lianhua Qianwen Jiaonang is very effective in treating the COVID patients, especially in the initial stage. You can use it to alleviate or relieve the symptoms or preventing the symptoms from getting worse. But you never use it for prevention, please. Because it is like Panadol, like our chief executive Carrie Lam said, it is not for prevention. It is like Panadol. If you experience some symptoms, you can take it. If you don't have symptoms, don't take it. Lianhua Qianwen Jiaonang is suitable for the wind hot type of flu. So how can you differentiate whether you're hot type or cold type? Here I'm going to share with you 5 simple tips that you can know how to differentiate. Number 1 is, if you have the wind hot type of flu, you will feel more warm than cold. Both hot and cold type of flu could have fever, but hot type could feel warmer usually, and you will sweat easier than the cold type of flu. Number 2, you will notice yellowish phlegm or nostril discharge. Number 3, the hot type of flu usually comes with a bit of constipation or hot stew. Number 4, reddish tongue and yellowish coating. When you have inner heat or you are more hot type of body constitution, your tongue side is more reddish and comes with yellowish coating. If your dampness is severe, then your coating sometimes will be much thicker. Number 5, if you're not too sure, ask a professional. These days, a lot of Chinese medicine clinics are offering online consultation. So if you're tested positive and you cannot go out, you can also use WhatsApp or Zoom to do the online consultation and clarify with your practitioner whether Lianhua Qianwen Jiaonang is suitable for you. According to the instruction, the recommended dosage is 3 times a day and 4 capsules per time. I think this is the recommended dosage for adult. So if you have children under 12, then you should use just half of the dosage. And if you have children under 6, then you should use just 1/4. And if you have children under 3, then I don't think you should use it with the guidance of your practitioner. There are nothing that is not safe for pregnancy nor breastfeeding. However, there are 2 particular ingredients that I want to bring to your attention. The first one is the Japanese honeysuckle. Okay, this particular ingredient is not suitable for those who is suffering from G6PD deficiency. G6PD is an enzyme that can protect the red blood cell from being damaged. So if you have this disorder, then I would not recommend this Lianhua Qianwen Jiaonang to you. And also, the second ingredient mentioned here is the Ephedra herba. So this particular herbal is easily causing heart palpitation. So if you have unstable hypertension, hyperpressure, or your heartbeat is not very regular, then you should use this particular herb with caution. So if you want to use 莲花清瘟胶囊, you better ask your practitioner, your TCM doctor. If you use it under the safe range and recommended dosage, it shouldn't have any side effects. But if you are the cold type and then you keep using it for a long period of time, it may cause some discomfort in your digestive system that may express in a way that you will feel bloating, you'll feel some discomfort in your stomach, or even you may have loose stool or diarrhea. Some Chinese herbal medicine has reported to have caused liver damage in some cases. So that's why the Chinese government has listed 60 herbals under observations, and then reminding practitioners to use with cautions. And here in this formula, the listed ingredients has nothing related to those 60 herbs that is under observation. So it's very safe to use, I would say. However, you should use it with the safe dosage. Here we have mentioned about 3 times a day and 4 capsules per time. And also, you should not use it over 7 days. This is not for long-term use. This is not for prevention. This is not for wellness. This is medicine. So you should use it no more than 7 days, and it should be very safe.